Now we are to talk about the fourth and the final method of calculation of the heart rate using the ECG paper. The first three methods are good, but they have got a limitation. In case of the atrial fibrillation and in case of the complete heart block, we cannot use these three methods. Let me explain it by drawing the atrial fibrillation and complete heart block on the board. Now this is atrial fibrillation where you see an irregularity of R to R interval. So when there is an irregularity, you cannot apply first three methods because they require that both there should be equal distance between the R waves. So you can count number of large boxes or small boxes, or you can drop digits of 300, 150, 100, 75, 60, 50, 43 and 37 on those R. But these are irregular, so you cannot apply either of the three method in the case of the atrial fibrillation. Let me draw complete heart block. In case of the complete heart block, when the ventricular rhythm is active, there is a broad QRS complex and rate is somewhere 20 to 40. When the rate is between 20 to 40, it can be 25, it can be 28, 9, 30, 32, but our digit falls down to like around 37. So here too, we cannot apply all the three methods. So for this reason, we have got a method 4 for calculation of the heart rate on the ECG paper. Let's study what is method 4. Method 4. For method 4, we should understand two or three things which are important for this understanding of method 4. We should know the duration of these small boxes and large boxes on the ECG paper. This is a large box. It has got 5 small boxes horizontally. Okay. So horizontally, there are 5 small boxes in a large box. 1, 2, 3, 4, 5. Now, duration of one small box. Duration of one small box is 0.04 seconds. This is very important. So when we look at the ECG paper, there are large boxes and in it are small boxes. Now the duration of one small box is 0.04 second and duration of one large box which has got 5 small boxes will be 0.04 into 5. It would be 0.20 second. This is one small box. Its duration is 0.04 second. And this is one large box. Its duration will be 0.04 into 5, that will be 0.20 seconds. Okay, good. So looking at here, duration of one small box is 0.04 second and duration of five small boxes, which is equal to one large box, is 0.04 into 5, 0.20 second. Okay, let me draw 5 large boxes together. Let's draw 5 large boxes. Okay, 1, 2, 3, 4, and this one is the 5. This is one large box, this is second, this is third, and this is fourth. Okay, let me make small boxes here. Okay, let's draw small boxes. So these are 5 large boxes. 1, 2, 3, 4, 5. Let me make it even bolder, the large boxes, so that we can appreciate that there are 5 large boxes. Okay, now the duration of one small box is 0.04 second. Duration of one large box is 0.04 into 5, 0.20 second. And duration of 5 large boxes will be 5 into 0.20 second, it would become 1 second. So duration of 5 large boxes is 1 second. So duration of one small box is 0.04 second. Duration of one large box is 0.20 second. And duration of 5 large boxes is 1 second. But story doesn't end here. We are to know the duration of 30 large boxes. So I'll draw a diagram of 30 large boxes. So here I have drawn 30 large boxes. Now the duration of one small box, duration of one small box is 0.04 second. Duration of one large box which has got 5 small boxes is 0.04 into 5, 0.20 second. Duration of 5 large boxes point 20 into 5 is 1 second, and duration of these 30 large boxes, duration of these 30 large boxes is duration of 30 large boxes is 1. So one large box has a duration of 0.20 second. So how much duration will have 30 large boxes? 0.20 into 30, and the answer is 6 seconds. 6 seconds. This is not a futile exercise. This is very, very important understanding of the duration in order to completely understand method 4 of calculation of the heart rate on the ECG paper. What? Duration of one small box is equal to 0.04 second. Duration of one large box is equal to 0.04 into 5, 0.20 second. Duration of 5 large boxes is equal to 0.20 into 5, that means 1 second. and duration of 30 large boxes would be 6 seconds. So what we do in this method, first of all, on the rhythm lead, because rhythm lead has got 12 R waves most of the time. It is not the 3 R wave complex like the rest of the ECG. Rhythm lead, whether this is the V1 or the lead 2, it is a long strip. It's a long strip, 12-second strip. On that rhythm lead, first of all, we identify a duration of 30 large boxes or a duration of 6 seconds. Then we count the number of R waves. Then we count the number of R waves in those 6 seconds or the 30 large boxes, and we multiply that number of the R waves with 10. Let me draw an ECG over here. This is a 6 second strip. This is a 30 large boxes strip. Let me draw an ECG tracing over here. P, Q, R, S, T. 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 So this whole strip, this is a 30 large box strip. It's a 6 second strip. First step is to identify a strip duration of 30 large boxes or 6 second duration. Then count number of R waves in that strip. Count the number of R waves in that strip. Let's count it. 1, 2, 3, 4, 5, 6. This 30 large box strip or a 6 second strip has got 6 R waves. Then we multiply this number of the R wave, which can be 6, which can be 8, which can be 2, which can be 11, with 10. First we identify a 6 second strip which comprises 30 large boxes. Then we count the number of R waves in that strip, and then we multiply that number of the R waves with the 10, and that gives us an answer which is the heart rate in that ECG. So what is heart rate over here? 1, 2, 3, 4, 5, 6 multiplied with 10, that gives a heart rate of 60 beats per minute. So let's wipe it off. So what are the steps of the method 4? Step 1. Step 1 is method 4 has got certain step 1. Number 1, identify an ECG strip that would be a rhythm strip. ECG rhythm strip of 6 seconds, i.e. comprising 30 large boxes. So this is step 1, that you will identify an ECG rhythm strip of 6 seconds that comprises of 30 large boxes. Then step number 2, count the number of R waves in that 6 second strip. Okay, this is step 2. 3, multiply that number of R waves with 10. So if you concentrate a little bit, you identify there are two constants like 6-second strip, a 30 large box strip is constant, and the number of R waves will be multiplied with 10. 10 is constant. So the first step is to identify the ECG rhythm comprising of 30 large boxes, that is 6 seconds. Count the number of R waves in that 6-second strip, and finally multiply that number of the R wave with the 10, and that gives you a heart rate. This is the final and the last method of calculating the heart rate from the ECG strip, and it is very useful especially in cases of the atrial fibrillation and in cases of the complete heart block, because in these two conditions the first three methods fail to correctly identify the heart rate. So this actually completes 4 methods of calculation of the heart rate using ECG paper.